Today we are going to talk about breast augmentation, the pre-operative and post-operative care after breast implant surgery. Breast implant surgery or breast augmentation is the second commonest cosmetic surgery that is done all over the world after liposuction. Breasts form a very integral part of women's anatomy, and enhancement or aesthetic surgery of breast is very common. The well-formed and aesthetically pleasing breast improve the self-esteem of women, and hence many women undergo aesthetic breast surgery, especially breast augmentation by breast implant. Without going into too many technical details, breast augmentation or breast implant surgery is essentially putting two balloons which are made up of silicone under the breast or under the pectoralis major muscle on the chest to improve the aesthetics of the breast. This mainly increases the size. It also fills up the breast and gives a very nice contour to the breast. This is technically not very difficult surgery and can be accomplished within an hour and a half, and this requires general anesthesia and can be done as a day case without overnight hospital admission. What are the pre-operative requirements or the care that one has to take? What is most important is to have a proper consultation with cosmetic or aesthetic surgeon regards the type of breast implant, the size. This is very important because choosing the right kind of implants is essential for a very good outcome of the surgery. So it is essential that both the patient and surgeon agree to the size and type of implants that a lady would want to have for breast augmentation. After having decided the type of implant and the size, the next thing is undergoing some pre-operative investigations to make sure that there are no physical comorbidities which can impair the recovery from the surgery, namely trying to make sure that there is no anemia, which with a low hemoglobin a person can have a delayed recovery and delayed wound healing. So it is important to make sure that one is in a healthy condition before undergoing this surgery. Secondly, it is important to stop some medications, especially the blood thinners like aspirin or any other medication, because if these are continued into the surgery day or up to the surgery day, what can happen is that you can have excessive bleeding into the wound, and that can cause blood clot formation in the wound, and that can be a troublesome complication. Abroad, they instruct the patients to stop smoking 2 weeks prior to the surgery. Although the prevalence of smoking is not so common in India, if some patient does smoke, it is important that that person stops smoking 2 weeks prior to the surgery, because smoking can have deleterious effect on the post-operative recovery. Especially they can have chest infections, and also the nicotine also causes hampering of blood supply to the wound, and that can also lead to wound complications. On the day of surgery, the patient is instructed not to consume any water or any beverages or any breakfast, and to report to the surgery on empty stomach. A person is allowed to have a tablet such as blood pressure tablets, those can be taken with a sip of water. But apart from that, one should not take anything by mouth. And after taking shower, and person should report to the hospital along with the blood investigations that have been ordered by the surgeon. And as I said before, the surgery is done under general anesthesia. It takes about hour and a half to 2 hours for the surgery to be done, and usually person is kept under observation 6 hours after general anesthesia. And once the anesthetist and the surgeon is sure that the person has recovered from anesthesia, the person can go home. Many patients prefer to stay overnight and leave hospital the day after the surgery. What is the care that patient should follow after this kind of surgery? It is important that the person should take adequate rest after surgery, which involves about a couple of days, and the person can be ambulatory soon after the surgery. There is no need to be bedridden or anything, and generally person is allowed to take a shower 2 days after surgery, and it is safe to take shower, and then that will not cause any wound infection. And if the surgeon has applied a waterproof dressing, then absolutely there is no risk at all of any problem happening to the wound. As regards the diet, a person is allowed to take the normal diet, and there are no dietary restrictions. And alcohol should be avoided if a person is already on some medication that may interfere, where the alcohol may have a side effect, deleterious side effect on the pain medication. Person can start a light exercise 2 weeks after the surgery. It should not be vigorous like aerobics, jumping, and which would cause a lot of shaking of the breast area. But gradually person can keep on increasing the level of exercise, and then person can resume more active exercises 6 weeks after the surgery. One should also not lift anything heavy for about 2 to 3 weeks, not more than a couple of kgs, I suppose. And after 6 weeks, these restrictions are not, there are not many restrictions about the weight that you can lift. If the implant has been put under the pectoralis major muscle, then vigorous activity like swimming and all that should be done only after a couple of months. About the sleeping, a person can sleep on the back and on the sides also, but one should not sleep on tummy, where it would lead to pressure on the implants, and that is not advisable. What I would say is that sleeping on tummy is not advisable, or it should not be done, because that would cause a lot of pressure on the implanted, on the operated area, and may lead to problems with the wound healing. As regard the stitch removal, most of the surgeons prefer to put dissolvable stitches, so they don't need to be removed. If there are any suture ends that are kept outside the wound area, those can be trimmed 2 weeks after the surgery.